I think you've seen that the title I gave my talk was Caregiving or Scaregiving. And it's about what attachment theory has to offer to the discussion around anxiety, fearfulness, panic attacks, because I think it's all of us have had clients who have come to us with high anxiety, and we've all felt anxiety. So it's such a huge subject that my brief is to speak quite specifically to what attachment theory has to offer. So I think the first thing I'd like to say is that the central premise of attachment theory is that our sense of safety in the world is a learned security from our primary attachment figures, usually our parents, but parental figures. So they essentially communicate to us in a myriad of ways that the world is either safe and secure and exciting, or it's an unsafe place to be, a frightening place to be. And it really depends upon their own relationship to their external environment and their internal environment, how anxious they are. So I don't know how many of you know about the adult attachment interview. I can certainly talk about that later on if you want to know a bit more. But the most important thing that came out of that piece of attachment research is that although a traumatic event has a big impact on how we feel, it's actually how our needs are met after the event. So how our primary attachment figures respond to us when we go to them in our distress. That's the definitive bit in terms of recovery. So the main reason for this is that if someone is really there for us, they can act as a safe haven, which brings our fear levels down, much like we've just done in the exercise. But secondly, once the fear levels drop, they can be our secure base, enabling us to reflect on ourselves and what the trauma means to us. So in terms of regulating anxiety, this safe attachment figure who can hear how we feel is really key, and more key from the research than the actual original trauma is. And this tells us something really important about how much we can help regulate our clients' anxieties when they come to us, because whatever it is that they have experienced, how we respond to them when they tell us about it is really therapeutic.
So going on to the actual anxiety disorders, I was just looking at counseling directory, and there is for months, for years together, the word anxiety is the most Googled. And yet we don't seem to have a real solution to the problem. It has been researched, and there's a persistence of anxiety. Despite, I've taken this work from Lancet and other things. Despite the substantial disease burden of anxiety disorders, physicians have a poor understanding of factors that predict their typical persistent course. Results outline a profile of patients with specific clinical and psychological characteristics who are particularly vulnerable to anxiety disorder persistence. Clinically, these patients probably deserve additional or more intensive treatment to prevent development of chronicity. Going back to what Tori said about, how we all have been dealt with in childhood, and how anxiety has been dealt with to some extent. Some of us will be more anxious than others, but we'll all have anxiety, and how we deal with it, and how mother has managed your response to your own anxiety. I can definitely say that I'm a somewhat mixture of the anxiety of my mother and how my father dealt with her anxiety, or his own for that matter. And I can see it. I can see how, I can talk the talk, but when there's a real problem, a real crisis, how I respond, how there are bits of my mom in there and other people. So really important. I like that point that we need to, as psychotherapists, think about how we are too in the room. Alan Shaw, I don't know if you've had Alan Shaw in Brighton, but I did attend one of his conferences in London, and he is really devoted to this idea of working on psychotherapy. Contrary to David Smale, he thinks psychotherapy is the best thing, and that the way a psychotherapist responds to the client, the amount of work, the diligence with which we have trained ourselves, and the amount of work we put into thinking of each response and how we've been with the person. He's done tremendous work, and out of all his work, this is he's also used neuroimaging. I mean, the very first time that I saw that was in my training, when he's one of the people who researched the Romanian children who were left on their own. And I think Tori was talking about the experiment about children left in the room and the mothers absented, but here the children just didn't have the mother. So yeah, and that the brain itself can be damaged by that, the development of the brain. So he's gone into all this, and what he's come up with, he's highlighted the benefits of attunement on affect and emotional regulation. Therapists' emotional responses, Therapists' emotional responses help give meaning to experiences, and we know that we do that. Affect is regulated via the bond with the therapist, and it reduces anxiety. Psychotherapy provides symptomatic relief via the right brain to right brain attunement. Enactments and reenactments brings deeper attunement with clients' disrupted self, which can be challenging for the therapist's inner self. And I will be giving examples of this, how it has been challenging to the inner self, to myself for sure.
And so my focus is, as Shelley was saying, is on the body and looking at anxiety through a bodily based approach. And I'm a Gestalt practicing therapist as well as facilitator and trainer. So I also work in nature. I'm a nature allied psychotherapist. So I think nature plays a big role in regulating how we feel. Even if there's been a lot of research that even if you live near green spaces, you can feel the sense of physiological change of regulation. It's when you live in the grey cityscape that it becomes quite hard, and particularly, I mean, I'm going to look at this a little bit later about the collective anxiety, particularly around the pandemic and the things that we are still going through. But I think living in the cityscape really kind of, your body remains in this kind of hyper stress mode where you're on sort of vigilance and hyper alert more of the time than we think. So Gestalt, really, if I just say a little bit about the Gestalt model, it isn't about finding a solution, or it isn't a technique. I think people sort of tend to think of it as an empty chair approach or something that is a tools-based approach. Really, fundamentally, it's about bringing awareness for the client or the patient to support them to build awareness of what is going on for them relationally, in an embodied way, what's going on in their inner state, their inner sensations, bodily feelings, emotions, and how does that impact on the narrative that they tell themselves, the self-talk, and often the critical self-talk that they tell themselves. So Gestalt is based in Eastern philosophy. So it's really rooted in, what I can say about this is that mindfulness is very much a buzzword right now. But Gestalt, when Pearls, Heffeline and Goodman first wrote the first sort of tome, Gestalt tome in 51, it was published 1951, it was really rooted already in that Eastern philosophy of bringing to awareness what we might hide from ourselves. And it's also very much about contact with the other person, contact with the world, what it feels like for a client to reach out into the world and get what they need, what it feels like when the client can't do that, when they are stuck, when the energy to do that, to reach out, is stuck inside